Hi friends, welcome back to the channel and another video. If managing your in-basket is quite literally the most annoying, most dreaded tasks that you do in your workday, you're not alone. I always say if I can have a clone of myself who just manages the in-basket and I just focus on seeing patients and completing charts, I think my work life would be absolutely ideal. But until then, the workflow that I have to manage my in-basket works for me just fine. And so today I want to share with you how I manage my in-basket to maximize productivity. Now, I use the Epic EMR. I love Epic, and this is kind of how the in-basket looks like on the Epic EMR. I'm sure there's a version of this for every type of EMR, but this is what the Epic one looks like. So when I come to the office each workday, of course I start seeing my patients, and then in between seeing patients, as I have downtime, then I start tackling the dreaded in-basket. Prior to having a workflow to manage my in-basket, I used to be all over the place. Like I mentioned in my previous video, I used to think that I needed to complete everything in my in-basket, all my administrative tasks before I left the clinic each workday, and I used to leave the office around 7 or 8 p.m. nearly every workday. This was a massive part of what drove me into burnout. It was a nightmare. So I needed to come up with a workflow that worked better for me, and I'm still able to address all of the important tasks that need completion for that workday. So as I mentioned in the previous video, I have some general guidelines that I use to prioritize the must be done tasks for each workday. Now I'll go through the general guidelines as a whole, but then we'll dive into each one of those sections in more detail. So for lab results, I strive to review the results and inform patients no later than 3 to 5 business days post-visit, granted that all of the results have actually resulted. Now there are some caveats to this, so I will get into that in more detail in a bit. Everything else in the in-basket, refill requests, patient calls, patient advice requests, I strive to address those no later than 2 to 3 business days from when I received that message or request, etc. There are some caveats here as well, so we'll get into more detail in a bit. For any urgent requests, I typically prefer my assistants let me know verbally, so in person, in addition to routing that request to me. Because if it's urgent, we want to make sure that request is handled in a timely manner. Now, one thing to note is that any requests made through the patient portal or any messages sent through the patient portal are meant to be non-urgent, which means that the patient does have to allow a turnaround time of about 2 business days to receive that initial response, which most often, again, depending on how you manage your in-basket, that initial response is either going to be from you or your assistant. And so for me, lab results will come directly to me, but things like refill requests or patient advice requests, patient calls, the assistants will get those messages first before they route them to me. If there's a message or a request that my assistants can take care of, then they'll do that. I don't necessarily need to get involved in that, but obviously anything that requires my attention, so obviously sending prescriptions and all that kind of stuff, they'll route those to me to address. Now, if a response is needed from me, then the turnaround time would be about 2 business days from when I received the message or request from my assistant. So that's why I mentioned earlier that for any urgent requests, I prefer that my assistants let me know verbally, so in person, in addition to routing that request or message to me, so that I can address it in a timely manner. That is the general stuff out of the way. Let's get into a bit more detail on the major tasks and how I actually manage those. So the majority of the time, I typically start with lab results. Now, this can change. I may start with one of the other tasks like patient calls, advice requests, etc. It really just depends, but the main thing is to follow my general guidelines so that I stay on task and I stay productive. Before I even start addressing anything in the in-basket, as I mentioned before, I typically tag the message or request or lab result that I plan to address that day before I actually start addressing them, because this allows me to be intentional about what I need to get done that day. It helps me to prioritize these must be done tasks. So for lab results, again, that is what I typically start with the majority of the time. As I mentioned, I strive to review the results and inform patients no later than 3 to 5 business days post-visit. Most of the time it's going to be around 2 to 3 business days, granted that all of the results have actually come in. If the results have not all come in, that's usually when it takes a little bit longer, around that 5 business days post-visit. As far as informing the patients, I typically do this myself. Of course, every provider is different. I have colleagues who will review the results, put a note in, and then they'll have their assistant inform the patient. I will review the result, put a note in, but also inform the patient. This is something I still continue to do myself. I just personally feel more comfortable doing it that way, but you can do it another way, like I mentioned about my colleagues. Either way is fine as long as it works for you. Now, sometimes, let's say for example, for a particular patient, some results have come in, but some have not yet. But the ones that have come in, there's a critical finding. So there's something that needs urgent addressing, and usually you'll see like a double red exclamation marks on those. I'll usually address them that same day, even if that patient I just saw yesterday, right? So those general guidelines will go out of the window. This is where those caveats come in. The general guidelines will go out of the window because those critical findings findings need urgent addressing, and then once the rest of the results come in, then I'll just let the patient know at that time. The other caveat is if a patient had like 1 or 2 tests done. I typically prefer to get these result encounters just quickly addressed because they're quick. There's only 1 or 2 things that need to be reviewed, and so it doesn't take up too much time, and it will ultimately cut down on the amount of result encounters that I have to address. The other thing I wanted to mention is that encounters where the results are completely normal, meaning that there's nothing even slightly out of range, I don't message or call the patient about those. They'll see their results in their portal, and that's that. The last thing I want to mention about lab results is that if I am out of the office, so let's say for a few days, a week or so, then of course that's going to delay the review and getting back to the patient about those results. Patients always have the option to follow up with another provider to discuss their lab results. If they don't mind waiting for me to come back, then of course I'll get back to them once I return to the office. So I believe that is everything about lab results. If you have a question, definitely do let me know. But we'll move on to the next section in the in-basket. That's going to be either patient calls, refill requests, patient advice requests, etc. I don't have any rhyme or reason as to which order I go on those. It's just a matter of making sure I follow my general guidelines to get those completed. So we'll do advice requests next. For me personally, any messages that come through from patients will go to the nurse pool first, meaning that my assistants are going to be the first ones to see those messages and try to see if they can address those before they send it to me if I am needed. So my main assistant knows my workflow very well. She understands my workflow very well. And so the majority of the time she can take care of the majority of those patient advice requests. This is something I am so grateful for because it cuts down on the amount of messages that I have to address and the amount of time that I have to spend in my in-basket. Of course, if there are any messages that require my attention or my response, or she just wants to double check on something, then she'll of course route those messages to me. She'll never hesitate to do so. The next section is going to be refill requests. Same concept. When those requests come in, they typically go through to my assistants first. So if there's, let's say, a request for a refill, but the patient already has refills at the pharmacy, my assistant will just call the patient and let them know like, hey, it looks like you already have refills at the pharmacy. You don't need a new refill. My assistant will still route that request to me. And usually when she routes that request to me, she'll put a message on there. The patient already has refills at the pharmacy. So I know that I don't need to necessarily send anything in. I'll just check off that the request was already handled. For the other refill requests, pretty straightforward. I'll either send the refill in or the patient may be due for a visit prior to a refill being sent in. Again, my assistant knows my workflow very well, so she already knows which patients will need a visit, which ones don't. If they do need a visit, she'll go ahead and schedule them for the visit, and she'll route that request to me and just say, patient already scheduled for a visit on this date. Fantastic. For patients who are required to have a visit prior to a refill, but let's say due to some conflict they're not able to come in time before they run out of the medication, usually I'll send in a short supply to hold them until they get in for their appointment. The fact that, I have an assistant that knows my workflow really well really cuts down on a lot of the heavy lifting that goes into a lot of the in-basket stuff. The next section is patient calls, and those are addressed in a similar fashion. My assistants will be the ones to receive those calls from patients. So anything that they're able to address, they'll address. Anything that requires my attention, they'll route them to me and I'll address it. Again, about 2 business days from when I received that message. Again, for all of these things, if I am out of the office for a few days, a week or so, then obviously there's going to be a delay in getting back to patients about their requests or calls, etc. If there is anything urgent, especially like a patient call or urgent request, then my assistants will obviously typically let a provider that is in the office know, so that way that request can be done in a timely manner. Anything that is non-urgent and can wait for me to come back, then I'll address it when I get back. So once I've addressed all of the in-basket tasks that I tagged, as well as any urgent requests, then that's it for that day. I've completed my prioritized task for that day. Anything else that has not been tagged that day will wait for the following day. I will not stress myself to do more unless I want to or have the time to do so. But at that point, I am happy with what I've done and I am okay leaving the office and leaving anything else for the following day. That helps me be efficient and productive in completing the most important tasks for that day. And it helps me to not get overwhelmed, drained, or risk falling into burnout. So this video was just to give you a quick rundown on how I manage my in-basket to stay productive and be able to get all of the most important tasks done for each workday. Obviously, you don't need to adopt a similar workflow, but if there's anything in here that resonated with you and that you feel might be able to help you manage your in-basket a little bit better, then definitely take what you need from this video. As you've seen, having an assistant that knows my workflow really, really well is a game changer in itself. So if you have an assistant, take the time to train your assistant on your workflow and how you want things managed. Because when I say this helps in the long run, it is an understatement. I don't know how I would be able to manage without my assistant. All right, friends, I hope this content was interesting to you. If it was and you'd like to see more content like this, then definitely consider subscribing, because I do post a video like this every single week. If you are serious about scaling your work RVUs and significantly maximizing your income, income, then definitely check out our RVU consulting program. The link is below if you're interested. Also, make sure to check out the free training video linked below as well. Thank you so much for watching. Make sure to leave a like and share this video with your colleagues. I'll see you next time.